What's up, you guys? It's your boy Miguel giving your daily dose of radiation. Today's video, we're covering Xray Tech Protocol for C-section. The infamous, the mothers who give birth and they're in 6, they get sliced to get the C-section, which is a surgical event that happens at our hospital, which, I mean, I've seen it done a few times per day. Seen it done it happens, I would say, a few times, because I mean, every single day someone gives birth around the hospitals and stuff like that. And regardless if they forget something or if they don't forget nothing, it's standard protocol to get a KUB on the mother and most likely maybe the baby, depending if the baby goes to NICU. You may add a second exam to the procedure you can kind of expect. So yeah, just usually they're looking for like a scout KUB to see they make sure they didn't leave any metal. So usually it'll be like scissors or any metal. Like you'll be able to see, like if they accidentally for some reason left something, you'll see it. It's like bright because it'll be metal, complete metal. I've never seen nothing in a patient before. Doctors, of course, will always look at your picture and be like, no, we're clear. It should be very obvious if it's an artifact because it's like metal. So standard KUB, I would say, because you are in a surgical place, and depending on the patient, sometimes they've already been completely, like the patient has already been sewed up. Other times they're about to be sewn up because they just need the scout to make sure everything's good to go. So it all kind of depends. So you have to maybe kind of be careful. You will have to completely gown up because technically we are going into surgery. We're going into a surgical place. So you wear the whole, the gowns and the little booties, the whole shebang, as I call it. And then usually you'll come back down to the department, you put it online, it should get read, everything should be fine. And usually that's kind of about it. And then once again, after you shoot the mother, depending on what's going on, either at the actual OB, they'll tell you, hey, we're gonna need you also, there's a NICU, to go shoot the baby. Or sometimes you just come back down and they'll put the order. It depends. Usually if the baby was born prematurely and they're not too good, then they'll go to NICU. But usually in our department, they'll kind of call us when they're ready for NICU, unless they will call us right away, or the nurses who are from NICU already are there and they'll kind of tell us, hey, can you head down to NICU, which is pretty close since it's in the same little section. So that's usually about it. Nothing really to it. Most of the time when the order does spawn in, you kind of wait for them to call you, because since it is surgery, sometimes the doctors will put the order ahead of time before it actually happens. So most of the time, or if you're really busy and you just kind of want to get it, just call and ask them. But usually they will call us, at least in our hospital, they'll call us. So yeah, it's pretty where we go. See you on the next one.